Come in.
Hi, I'm Annette. I am your student nurse here to take care of you before you're discharged. I have an order here for a vaccine, but I need first your name and date of birth, please.
Ruth Brown, 11234.
Okay, perfect. Ruth, do you have any allergies?
Uh-uh.
Any medications? Okay, thank you. Do you need to actually use the restroom before I go into further detail what we're going to do?
Nope.
Okay. Well, what I have here is an order for a pneumococcal vaccine that will go, that will be with a, that'll be an IM, so it'll go into your muscle. We'll need to use a needle. And so the vaccine actually is given to about older adults or people that are younger or have compromised immune systems. It does protect you from the pneumonia, so different strains of pneumonia. So some side effects that you might have with the injection are soreness, redness at the site. There might be maybe a little lump. It sometimes helps to move your arm around. You may have a fever. You may be a little nauseous, so you can lay down for those, and that might help with the side effects. They should only last a couple of days. If you do notice any dizziness, tingling, numbness anywhere in your body, contact your physician right away, and I'll give you actually a form with all of this information with your discharge papers so that you can take home and read through it, and we can go through it too if you want to we'll go through it before you are discharged. So I'm going to go grab the vaccine. Do you have any questions?
I do not.
Okay, so this should take about 5 minutes. Can I get you anything to drink before I leave?
Nope.
Okay, and you have your call light next to you. Perfect. And the bed is in the lowest position. Wonderful. Okay, so I'll be right back, and we'll get that vaccine done, and then you'll be able to go home. Okay, so first I go into the med room. I'm going to check the orders for Ruth Brown, 11234. She doesn't have any allergies. The MRN number is 4670389. The order is for pneumococcal vaccine, 0.4 milligrams, 1 IM times 1 before discharge, which is right now on today. So I'm going to go ahead and wash my hands, and then I'll put on gloves, and I'll clean my area that I'm going to be preparing the medication. Now the syringe size that I'm going to be using is a 3 ml because we have a 0.4 milligram 0.4 milligram dosage, and the medication comes in a 0.4 milligrams per milliliter, so we'll use 1 ml of medication. And then the needle size that I'll use is a 25 gauge, and that is because she is elderly. She probably doesn't have as much muscle mass. And we'll still use 1-inch needle because it is an injection for a vaccine. So that's my reasoning for using those needles. So I cleaned my area. I'm going to actually take my gloves off again. I'm going to wash my hands, and then I'm going to don new gloves. So first, check. So the 5 patient rights are right patient, correct drug, correct dose, correct route, correct time. So we have Ruth Brown here, 112 of 34, no allergies to any medications. It is today's date that she'll be getting this medication. So I'm going to check the bottle that it comes in. Pneumococcal vaccine, 0.4 milligrams times 1. The expiration date, it's still good, so it's okay to use this medication. I'll get my gauze pads ready. So I'm going to grab my syringe and then the correct needle. So 25 is what I said, and 1 inch. 25, that's 1 and 1.5. What's a 22? There we go, 25 1 inch. Okay, so my area is clean. I'm going to open my packaging and just get everything ready. I'm going to take my alcohol pad, wipe the top of the bottle, just one swipe, clean it off. Okay, then I'm going to take the syringe, put it on there. So we're going to do a check again. Like I said, so we have the pneumococcal vaccine, 0.4 milligrams per 1 ml. So we'll use 1 ml. It'll be by IM, so we have the syringe and the needle, times 1 right now. So we'll go ahead and draw up the medication. Stabilizing the needle. There we go. So I'll draw up 1 ml of air to inject into the bottle, and then make sure that the bevel side is down on the bottle itself. Inject the air, and then we'll get the medication, trying not to get bubbles. There we go. Okay, so I have 1 ml here. I'm going to make sure that there aren't any more bubbles in. There we go. We had 1 more bubble in there. So now we'll make sure that there's 1 ml. There's 1 ml of medication. Take it out, safely recap it. Now, I would take a piece of tape and write the patient's name, date of birth, or the name, date of birth, what the medication is, the amount in there, today's date, and I'd initial it, and I'd have a second RN check it, and that would be the second check. So we'd have Ruth Brown, 1/12/34, pneumococcal vaccine, 0.4 milligrams per 1 ml. So there's 1 ml. IM right now before discharge. So I'll go ahead and dispose of all my trash, wash my hands, gather materials or equipment to go back into the patient's room. So I will need a gauze pad, the medication, alcohol prep pad, and then a Band-Aid. So we'll head back to the patient's room.
Come in.
Hi, it's Annette again. I have the medication here for the vaccine. Could you tell me your name and date of birth, please?
Ruth Brown, 1/12/34.
Perfect, Ruth. And do you have any drug allergies?
No, I do not.
Okay, so we've done the 2 patient identifiers. We've checked your bracelet and Aster. Ruth Brown, 1/12/34, no known drug allergies. So this is the 3rd med check. Ruth Brown, 1/12/34, no known drug allergies. Today's date, pneumococcal vaccine, 0.4 milligrams by IM before 1 time right now before discharge, which is right now. So I've washed my hands. I'm gonna go ahead and raise her bed, and I'm gonna raise your head of your bed too, Ruth, so that that way I have better access to get the vaccine in. I'll make sure I know where the sharps container is at, so I can quickly dispose of the needle. Okay, perfect. So I'm going to go ahead and wash my hands again, and then I'll don gloves and we'll get the injection done. Now you're going to feel a stick. I'll tell you when. Okay, so we have the medication. Go ahead and prepare the gauze pad. Have that ready. And then I'm going to access her arm. So Ruth, I'm going to need to take your gown off just at the shoulder here. Okay, so then to find the site for injection, you go 3 finger rests down from the shoulder, and then imagine it in an inverted triangle, and in the middle is where you'd want it to find it. Then you grab and make sure that you knew that where the muscle was at. Make sure you got enough there. And then you will go ahead and clean the area. And you'll go about 2 inches out and you'll go in circular motions, not going over top of where you've already cleaned. So. And then you can also put your alcohol pad kind of in an arrow pointing down to where you're going to have the injection. Okay, Ruth, we're getting ready to give you the injection here. Okay, so you're going to fill it poke. You go 90 degrees in. So ready? 1, 2, 3, poke. Now you're going to aspirate. Normally you wouldn't do this with the vaccine, but for this purposes we are, just to see if there's any blood. There's no blood, so you can slowly inject the medication. You're doing okay, Ruth?
Absolutely.
Okay, perfect. So then you're done. You want to quickly cap that and dispose of it in the Sharps container. And then grab the gauze pad and put that on there for her. And then you can also grab a Band-Aid at this point in time as well. So, put that on there. You're doing okay still, Rue?
Yep.
Okay, perfect. Put her gown back on. Take off my gloves, wash my hands. So, do you have any questions before we get you ready to go here?
Nope.
Okay.
Thank you.
Would you like your head of your bed up or down?
Down a little bit.
Okay. Still put the bed in the lowest position. You have your call light right here, so let us know if you need anything. I'm going to go check on your discharge papers. Tell me when.
Right there is good.
Okay, thank you. Now, can I get you anything to drink?
Nope, I'm fine.
Okay, so we'll be back with those discharge papers. Hopefully they'll be pretty soon, but thank you for letting me take care of you. And then I'd go ahead and make sure to also document. So I'd put the time, so it'd be noon, initial, put where it was at, right upper arm. And then I'd make sure to sign and date. So, oh, and also date here. And then the documentation would be complete. And thank you, Ruth. We'll be back.